County TV is here at Jersey City Medical Center at their EMS headquarters to learn about the rising heroin problem and the drug that is saving the lives of those who overdose.
So recently we've seen a rise in the increased use of heroin and other opiates, and it's become a real challenge statewide. So the governor's office had really kind of pushed for some new legislation that would expand access to this medication that can reverse opiate overdoses. Prior to this, over the past 30 years or so, our paramedics have carried this drug and been able to administer it for people having narcotic overdoses. Now, because of this new legislation, our EMTs can carry this drug, our basic life support staff, and we launched this program back on Monday. And matter of fact, within the first 12 hours of our launching this program, we administered the drug twice amongst our basic life support staff, and we're able to reverse a life-threatening overdose. This drug can be used to reverse any kind of an opiate overdose, so not just heroin and morphine, which is what a lot of people think of, but also prescription drugs, things like oxycodone, OxyContin, and those type of medications. And that's really where we're seeing the rise is in prescription drug abuse, less than we see kind of the use of heroin.
How many overdoses do you see per year?
Well, what we look at is how often we administer this medication. It helps us kind of rule out any reason someone might be unresponsive. And we do administer this medication about 650 to 700 times a year amongst our entire department. And that's just the paramedics. So now that we're rolling out to our EMTs, we think we're going to see a significant increase in its usage.
We even got a chance to see exactly how this drug is administered.
Well, first of all, you want to look for some of the signs and symptoms of someone who may be suffering from an opiate overdose. One of the main things we look for are constricted pupils, decreased respirations, pale, diaphoretic, clammy skin. All right, and the first thing you want to do is you want to open the box. You want to pop off both of these caps here, this vial containing the Narcan. Okay. All right. You're going to place these two together. You're going to screw them on. Going to All right, you're going to open this little piece here, which is going to go into the nostrils.
Okay.
You're going to screw it on. Okay. Now you place it up to the patient's nostril, and you're going to squirt in 1 ml.
Okay.
All right. Then once you squirt it in the one nostril, you're going to bring it over to the second nostril, and you're going to squirt it in the second ml. All right. So that's 2 mLs of Narcan, and after that, we're going to maintain the patient's airway, usually by putting in an NPA, a nasopharyngeal airway, and we're going to monitor respirations, check for blood pressure, and wait for paramedics to arrive or immediately transfer it to the hospital.
In Jersey City, I'm Ashley Bruno for HCTV.